Hello and welcome to Health Assay. I'm your host, Amazing Tife. Now, recently I was in the beautiful state of Ekiti to speak with the Commissioner of Health, Dr. Oyebanji Filani, on enhancing healthcare access and services in Ekiti State. We talked about current initiatives and the future visions. Now, here's how the conversation went.
I'll start with the current coverage levels at the state in terms of like some of the key coverage that are required to ensure that we're achieving universal health coverage. We are not doing badly at all. Immunization, as an example, we have 4% coverage for Penta 3, which is the indicator that is typically used during immunization to determine how well the immunization system of any country or any state, functions. So we're at 84%. That's the highest in the Southwest and the fourth highest in the country. The same for some of the other very relevant indicators where we're doing well as well. But that we're doing well in some, of course, there are others that we need to improve on. So for us, as an example, we need to improve on our delivery, skilled bed delivery, and the quality of the service that we deliver in these facilities. And so to address that, we've done quite a number of things. The first, of course, is at the primary care level, ensure that we have the ability to be able to revamp our health facilities. And that revamping cuts across the infrastructure and equipment, right? So we have 177 of them that we're focusing on, which is one per ward. So because we have 177 wards, and so we've revamped about 80 of those. Our plans to continue to do that, right? And with that revamp comes the infrastructure, but also the equipment. We're training our nurses and our healthcare workers in these facilities. Only recently, His Excellency Mr. Oyebanji approved, increase to wages to encourage, retain, and attract skilled workers, and also making sure that the commodities are available in the facilities. So we set up properly our drug management agency, now backed by law, to provide commodities, drugs to all the public health facilities in the state. At the secondary care level as well, we're doing things similar, making sure that we revamp the facilities. Out of 22, we've already done 12. We plans to do the remaining 12. We have 3 tertiary hospitals in the state, one state government owned, one privately owned, and one owned by the federal government. And so the state government owned as well as seen significant improvement in infrastructure and equipment, just to make sure that we have all that it takes to be able to provide adequate service to people. We have a close community of people, and we try to utilize that as much as possible. First, going through relevant institutions, traditional and religious institutions, and also the different sort of like stakeholders within the community, the Yalojas and the Yelanjis as an example. So I'll give you a couple of examples. We're expanding our state health insurance program now rapidly, and we've been going to the different communities. When we get there, we're engaged with the traditional ruler, we're engaged with the religious leaders, we're engaged with the associations, the different unions and associations, first to encourage them, right, to register, but more importantly also to become champions and to spread the word. We also use that opportunity to get feedback from them, try to understand what the issues are and where they think that government can be more responsive, right? So we do that quite regularly, almost about twice a month on a regular basis. Beyond that is we also have we've set up like a grievance redress mechanism where people can call us if there are any issues that need to be reported, and these issues cut across even for disease outbreaks, right? We have within communities what we call rapid response teams and disease notification officers who help to notify us of any illnesses or disease outbreaks in their community. So that is cascaded up very rapidly up onto the state, and we're able to take action. So the first thing we did was do training, right? You can only be as good as the person who is seeing you. So we need to improve the skill set of the health workers, right? So we've done quite a significant number of training. Over 1,000 people working at the primary care level have been trained over the last 2 years, just to ensure that they are able to, very quickly recognize early warnings or early warning signs for a challenging delivery, if at all, or even the pregnancy, right? So that has been done. Secondly, is to make sure that whatever commodities that are required to make this happen, that we provide. Thirdly, then, is to institute a continuous quality improvement program. We're lucky enough to be one of the few states that the MEC for Mothers MST program is supporting, right? So that will start within the next couple of weeks, and the goal is to ensure that we can improve the quality of services that are delivered in our facility. The third point then is how we then engage the community, right? It's not enough that you have these people trained. It's not enough that you have the commodities that people need to know, right? So we're, again, like I mentioned earlier, we're very active around community engagement. We've put together a hotline for people to call and let us know what issues there are, if any. And then finally is around our health insurance. We're rapidly scaling that up, and our goal is very clear to ensure that anyone who needs to, through the entire pathway from family planning down to antenatal to delivery and even postnatal, that you're able to get that free of charge at the point of use in the facility, because government has covered for it, or government is paying for it, right? So we're doing that across the entire state now, and that we believe should help reduce any maternal mortality down the line. Okay. So first, we need to recognize the environment in which we live on 2 points. One, there's a relatively high level of people who are vulnerable, right? And by vulnerable, I mean that they're unable to, pay for care when they need it, right? And so if you're unable to do that, it means that they can't even contribute at any point in time. So someone has to provide a minimum bare floor, which is the role of government, to provide that as a safety net. So there's a vulnerability issue, right? And again, like I mentioned, people should not have to be denied their dignity because they don't have the resources to pay for it, right? So we take note of that, and government has committed to funding, healthcare in that instance. The second also then is to recognize that even though we've committed to funding healthcare, the reality is that we can't fund everything, all the needs of all the people at a time, right? So would it be nice that we're able to take care of all, as an example, all cancer cases in the state? Absolutely. We would love to be able to do that. But the reality is that we do not necessarily have all of the resources to do that as at today, right? So the second point then becomes, if you then have a defined amount of money, would you, it's a question that is ethical, but something that people genuinely would ask. Would you treat one cancer case at a cost of, say, 10 million naira versus 3,000 malaria cases for 3,000 people, which is almost about the same 10,000 naira? So those are sort of the questions you as a policymaker, that you always have to grapple with. Plus, you then ask yourself, what is the disease burden in the state, right? So for us, what we've done in terms of, our benefit package is to look at what the disease burden in the state is, right? And our benefit package comprehensively captures 74% of the disease burden in Ekiti State as at the moment, right? So it's the basic things. It's women who want to deliver, right? It's antenatal, it's delivery up to CS, it's the children, right? And all the services that they need up until they're like 5. And then of course it's malaria, which affects almost everybody. So we've provided this as a suite of an explicit package. We're provided across all the public facilities in the state. And to the point I made earlier on, we're constantly engaging the community so that they are also aware, right, that if you need any of these services, you can go to any of these facilities to receive this care without having to pay for it. So training again is one, right? So with healthcare workers, you can't overtrain. That's why we have what they call CPDs, continuous professional development, right? So if you have modules, and they don't have to be fiscal class, if you have modules that are solid, that are approved by the relevant agencies at the national level, that's an opportunity for us to say, well, the CPDs for all our healthcare workers, you can explore this, similar to like what you have with Coursera or EDX or any of the other MOOCs, right? So if you have that sort of thing, then that's something that can be done. The laboratory space is very open, and there are opportunities there for entrepreneurs who may be interested in doing that. One other thing that we certainly would explore down the line is what we call sort of like managed care, right? Where we're able to consider, right, a cluster of primary health care centers that is managed by a private sector player, right? We still need to, that's something that may happen down the line, but it's not, we don't have it in mind in the short term.
Now, as my conversation with Dr. Filani came to an end, I was left with a deeper understanding of the tireless effort and visionary initiative underway to enhance healthcare access and services in Ekiti State. Dr. Filani's insights shed light on the current achievements, ongoing projects, and the promising future of healthcare in Ekiti State. Now, I extend my sincere gratitude to Dr. Filani for sharing his valuable time and expertise with me. His dedication to improving the well-being of the people of Ekiti State is truly commendable, and his leadership is instrumental in shaping a healthier, brighter future for the state. Now, this brings me to the end of this episode of Health Assay. If you've enjoyed it, remember to give it a thumbs up, remember to share and also comment, and then you can also follow me on social media at Amazing Tife. Until I come your way next time, cheers and stay safe. Bye-bye.